What's up, guys? Just wanted to go over a patient scenario that I saw last week and that we see frequently. And that is, we had a patient come in who he's in his early 50s, and when he was 50 years old, he came in saying, hey, my vision's not what it used to be, and his surgeon convinced him to do LASIK. And after the age of 45, it doesn't really make much sense for most people to get LASIK to correct their vision. And why is that? I want to draw a really ugly diagram here. So if we draw this, so this is a sideways view of your eye, like a cross section of your eye. So when you're young, you're 25, 30, your vision's never been that great, you've had to wear strong glasses, contacts, etc. It makes sense to, if your refractive error, you're like a -4 or a +3 or something like that, to go in and do LASIK, which reshapes this part of the eye, it reshapes the cornea. But later on in life, once you turn 45 and after that, this part of your eye is more dynamic, it's aging. Your cataract lens, or your lens starts turning into a cataract, and that means that it's starting to get harder, it's starting to get cloudier. Your cornea, for the most part, is about the same, So this is a more static structure. This is a more dynamic structure. And it does not make sense to alter a static structure when you have a dynamic structure that's continuing to age behind that. So patients who are getting LASIK when they're 50 usually means that the LASIK's not lasting that long. And that's what happened to this patient. He's like, my vision was perfect for a year, and then it went away, and I'm back in my glasses. And that's because you started to develop changes in your lens. Why do doctors do LASIK after the age of 45? It is quicker, it's easier, and for some patients it might be the right move, but it's not the norm, right? It's not typical. So what is the better option? To leave this intact and to go in and change the structure that is dynamic, to go ahead and replace this lens, doing what we call cataract surgery or refractive lens exchange, where we clean out this cloudiness and put in a lens implant that's specially sized for your eye. You'll never need cataract surgery again, and you leave this cornea intact. If someone's already had LASIK before, now this cornea has been altered, and we can still go back in and do cataract surgery, but it becomes a little more unpredictable. You might need LASIK again after that to make up for the differences in the lens calculations. You might, we use a lens called the light adjustable lens, which we can actually adjust the power of the lens after surgery. But no, it does not make sense to alter a structure that isn't really changing much when there is another structure that is dynamically changing. How does that relate to facelifting? So many facelift techniques rely on just tightening this part of the face right here and hoping to get some pull on the jowls. You can get some pull here from that, some pull on the neck just pulling from the side, but we have a fixed mass, which our parotid gland overlies this area. This part of your face doesn't really age much. No one's like, oh, like this part of my face has drooped a lot. It's usually about here forward. This is all the mobile mass that starts to fall with age, and it's a more dynamic structure. So when we do deep plane facelifting, we're not tightening this, we're lifting what's actually fallen back up to where it used to be. So it does not make sense to do a mini facelifting type procedure where you just lift up a bit of skin here, tighten this back, stretch the skin, because this is a more static area of the face, this is more dynamic. And that's kind of how this interplay between, similar concept, very different areas of medicine, vision changes versus facial aging changes. But with your eyes, you want to treat what is actually aging, which is your lens. With your face, you want to change what's actually aging, which is the SMAS layer that is more mobile, the deep fat pads, put them back up to where they used to be. Don't stretch and pull on something that hasn't really changed much over time.